Project Echo is a performance optimizer. Think of it as a high-speed internet connection for the healthcare system. It spreads new medical knowledge throughout the healthcare system, from university medical centres and other specialty care sites to the front lines of community care. Rather than information flowing in one direction, community providers learn from specialists. They learn from each other, and specialists learn from community providers as new best practices emerge.
There has been tremendous effort across the state of Arizona to increase the number of buprenorphine waivered providers. And if this was the goal to simply get providers waivered, these programs would have been deemed quite successful. However, despite these efforts, the reality was that very few, about 3%, were actually integrating MAT into their practices. And in looking at why this was, a self-perceived lack of knowledge and confidence in MAT best practices persisted, coupled with an ongoing stigma around OUD and OUD patients. In response, our team here at Arizona State University gathered an interdisciplinary team of specialists in MAT. These experts represent prescribing physicians, a pharmacist, a policy expert, and a harm reduction specialist. Together, this team built and launched our medication-assisted treatment ECHO.
We've been very pleased with the outcomes of the MAT program so far. We've had robust participation and engagement from the community. Nearly 300 learners have joined since we launched, and an average of just under 50 learners join each session. As you can see from these heat maps, our learners are spread across the state, with some learners joining from out of state. They come from rural and metro areas and practice in opioid treatment programs, office-based opioid treatment programs, hospitals, and tribal clinics. Our audience has been very interdisciplinary, including healthcare providers, behavioral health providers, peer support, administrators, and other professionals. This has made for a really rich discussion of the patient cases. We assess learner outcomes through post-session and biannual surveys. So far, these surveys have indicated high rates of satisfaction with the program. Our average satisfaction rating is 4.6 out of 5, with most participants reporting they're extremely satisfied. Participants have also reported improvements in their knowledge of opioid treatment after participating in ECHO, including general knowledge of the treatment of opioid use disorder, knowledge about medications to treat opioid use disorder, and knowledge about related treatment modalities. Similarly, participants have reported improvements in their confidence across a number of domains, from starting a conversation about opioid use disorder with a patient to assessing for buprenorphine contraindications. This side-by-side graph shows the percentage of learners who reported they were very or extremely comfortable with these domains both before and after ECHO. And as you can see, participants reported improvements in all confidence domains. As a whole, we found high learner satisfaction and improvements in learner knowledge and self-efficacy in providing opioid treatment using this ECHO model.
One of the key elements to expanding access to buprenorphine and methadone is understanding that people who are living with substance use disorder are survivors. All too often they're blamed and treated as criminals. Stigma, as we know, is alive and well, both for the patient and for the provider. So one of the things we really want to do at the ASU MAT ECHO is to give the backstory, right? To understand that folks have survived trauma, that they have high adverse childhood experience scores, and then it took a lot of courage just to even show up to the prescriber or provider's office to seek help. When we're curious about people's stories, and when we understand that substance use disorder is a complex biopsychosocial phenomenon, then we can meet people where they're at. We can walk alongside them and witness as they struggle and try to make positive change in their life, and we can kick up the level a notch.
Yay, yay, yay. Good job.